Greetings from IGCP Group of Publications and eMedi News. We present to you an academic feast on the subject vitamin D deficiency status in the country. In India, we know that there is enough sunshine, yet people from all walks of life suffer from vitamin D deficiency. Our requirement of vitamin D is much more, 1 to 2,000 units, and in the elderly, more than 2,000 units per day. We don't have a fortification process. Our people don't get enough vitamin D from sunlight. To answer these questions and misconceptions, we have with us Dr. Ambrish Mittal, Chairman, Metabolic Disorders and Endocrinology, Medanta, the MedCity. Let's listen to him.
Vitamin D is one of the most interesting molecules of the last decade in medicine. So much has been written about vitamin D, so much is being talked about it. It's sometimes very confusing and difficult to separate the truth from the hype. We will attempt to unravel some of the mysteries surrounding vitamin D and put it in a clinical, practical context for you. Now, we understand vitamin D metabolism classically as something that is involved in calcium homeostasis, which means that if we need to absorb calcium from the gut, we need adequate vitamin D. When vitamin D is deficient, then despite adequate calcium, it will not be absorbed in the gut, and therefore we will be deficient in both vitamin D and as a result in calcium. As a compensation for that deficiency, there is a rise in parathyroid hormone. This rise in parathyroid hormone actually pushes out calcium from the bone into the blood. So ultimately, in a state of vitamin D deficiency, the body sacrifices its bones to maintain a blood level of calcium. And when this phenomenon continues for years and years together, the bones get eaten up and we become more prone to osteoporosis. This is the traditional understanding of vitamin D. However, newer actions of vitamin D, which are not linked to calcium directly, have also been proposed. And very exciting areas. Vitamin D has been blamed in infections, in autoimmune disease, in various lung disorders, and even in various cancers, and now increasingly in diabetes and heart disease. However, all these studies that are on non-skeletal or non-bone effects of vitamin D are still in the process of evolution, and the final answer is not out. The associations between low vitamin D levels and these conditions are consistent, but whether treating with vitamin D will reverse these conditions is still being researched in a much deeper and better way. And therefore, we talk of two types of actions of vitamin D. The classical actions, which we are aware of, which are linked to calcium absorption, PTH regulation, bone effects. But also, as I said, there is a whole pathway of non-classical actions which may not be directly calcium dependent. How do we get this vitamin in our diet? What is the source? In one word, the answer is there is very little vitamin D in our diet, virtually nil in Indian diets. The pictures you see here are of milk, for example. Milk does not contain vitamin D unless it's been added. And in India, there is no policy of adding vitamin D to milk, so we don't get vitamin D through milk. Certain kinds of fish that are fatty fish, we don't eat those fish. There's a little bit in some grains and cereals, and there is little bit in egg yolk, which one egg yolk, for example, contains 20 units of vitamin D. The daily requirement is above 1,000 units. So 20 units is nothing. So really, food is not a good source of vitamin D in the Indian setting. And therefore, the other source of vitamin D in India, which is abundant, is sunlight. But we will talk about it as we go along. Let's look at the vitamin D data from India. There's tremendous amount of research done on vitamin D in India. And let's see where that has led us. Let's look at our most vulnerable group, children first, who we think should not be deficient given abundant sunshine in the environment. Yet, when we looked at Delhi school children, studies done at All India Institute, they have shown that as per modern classifications, 80 to 90% of these children had low vitamin D levels. And here we included both children from upper and lower socio-economic status. So the authors said that in this study, school children in Delhi, the capital city of India, both from public or private schools, had significantly low vitamin D levels in 80 to 90% of them. What about healthy schoolgirls in Delhi? Another study done again in upper and lower socioeconomic stratum children, healthy schoolgirls apparently 90% had suboptimal levels of vitamin D. So the problem is huge. What about pregnant women? You look at pregnant women as a newborn, shocking data from SGPGI Lucknow, which actually showed that pregnant women are seriously vitamin D deficient and the newborns are also vitamin D deficient. So there is a huge group of people, which means if you look at our population, we always consider children and pregnant ladies as high priority and newborns. And all of them in these studies were found to be significantly deficient. In fact, as I said, proportion of people who are deficient is huge, above 80% and almost touching 90%, at least in urban India. What about adults? Let's look at adults. Studies from North India, some of which we did many years ago, actually showed that the levels, especially in winter, are abysmal. And you can see on the slide, the levels mentioned are 3.19 nanograms, less than 5 nanograms per ml. These are really low levels because at the very least we require 20 nanograms of vitamin D to have optimum bone health. Probably we require 30, but at least 20. And here we are talking of 3, 4, 5. And in summer it goes up to 7, 8, 9. So these are really, really low levels of vitamin D that are widely prevalent in adults across North India. Even in rural environments, although the vitamin D levels improve because of greater sunlight exposure, in girls, as you can see on this slide, in girls there is still not enough vitamin D because culturally our girls wear clothes that cover them. So even in villages, they don't get enough sunlight to get enough vitamin D. Boys, of course, especially in winter when they play in the sun, they do manage to achieve reasonable levels of vitamin D. Data from South India is slightly better but not much different. If it is 80% in the north, it's 60-70% in the south. So I think we need to be aware that the majority of Indians are deficient in vitamin D. Some of the more recent studies done in Delhi, for example, in elderly Indians, not surprising again, the bulk are deficient. And then in this most interesting study done on more than 2,000 health professionals, that is doctors, who attended our vitamin D lectures across the country, and we offered a free vitamin D estimation to them. And we found that the vast majority of these doctors were seriously deficient. The size of the circle in this indicates the number of doctors studied, and the color red indicates those who are deficient. So you really can see that there is widespread vitamin D deficiency amongst health professionals in India. And based on this, all this data, we wrote a position paper for the International Osteoporosis Foundation, where we showed that globally vitamin D deficiency is a big problem, and basically it's even more pronounced in South Asia and in Middle East, which are very sunny environments, but because of various factors, they tend to become seriously vitamin D deficient. Why is that? Vitamin D status depends on the latitude. As you move towards the equator, you should be less deficient. So therefore, actually Middle East and India should be less deficient. But there is the issue of skin pigmentation. When our skin is pigmented, we make less vitamin D, which means we take longer to make the same amount of vitamin D as compared to people who are fair skinned. So there is a skin pigmentation. That is natural protection actually. Nature made it that way. But we have all moved inside, and therefore we are not getting enough exposure. Otherwise, to protect ourselves from harsh sunlight, we are darker skinned. As you move towards the equator, people become more and more darker skinned. You move away from the equator, you get that Boris Becker kind of skin where there is hardly any pigment, you know. Then there is issue of clothing. Culturally, we cover ourselves well, and therefore our skin is not exposed to that amount of sunlight. And there are cultural issues. You know, people are worried about their skin complexion and so many other things. And I call it the sun-fleeing behavior of Indians as opposed to the sun-seeking behavior of Northern Europeans and Americans who rush to the sun to catch some rays of the sun for sunbathing, whereas Indians run away from sun. And also there is some data to suggest atmospheric pollution will also be playing a role in vitamin D deficiency by allowing less amount of UV beta rays to reach our skin and therefore less synthesis of vitamin D. Example of sun-seeking behavior of the West, as you can see in this slide, this lady exposed, enjoying the sun, making good amounts of vitamin D. An example of our ladies who are exposed to the sun, where actually they are very well covered even though they're in the sun. And therefore, even there, we have not checked the D levels of these two women, but I'm sure they would not be as good as we would expect them to be for some workers who are in the sun all day. So when we look at the global status of vitamin D levels or deficiency, we find that the hot spot is really, as I said, South Asia and Middle East. While levels below 30 nanograms are common in most populations, levels below 10 nanogram that constitute frank vitamin D deficiency are more common in the elderly in the West, but in some regions such as South Asia and Middle East, frank deficiency is common in all age groups from the neonates to the elderly. This is part of the statement by the International Osteoporosis Foundation Working Group 2009. And it is possible that given these deficiencies, one will have to think of strategies other than just sunlight exposure or even fortification, and selected groups within these countries or these zones may actually require supplementation with vitamin D to achieve optimum vitamin D levels. So what is the recommendation for vitamin D for older adults? This is an area fraught with controversy, and as chair of the IOF working group on nutrition, we brought out this recommendation, Best, Dawson, Hughes and others, we brought out this recommendation where we said in populations such as Indians or South Asians, Indians, Bangladeshis, Pakistanis, Sri Lankans, we may have to have a normal intake of up to 2000 IU to maintain even moderate levels of vitamin D. So really, it's if you're going by the universal dietary requirements of 600 or 800 daily intakes, Indians will still remain significantly deficient. So if you're even looking at achieving 20 nanograms, you would need to have higher levels of intake, and some people think this might be as much as 2000 IU per day. Now remember that when we are talking of increasing vitamin D levels, a good rule of the thumb to remember is 100 units extra per day will raise your 25 hydroxy D level, which is the best index of vitamin D nutrition, by 1 nanogram. Right? So if you're at 10 and you have to reach 20, you will require 1000 IU at least to do that. If you're at 10 and you want to reach 30, you will require 2000 IU per day. So anywhere between 1000 to 2000 is what Indians would require to maintain reasonable levels of vitamin D. And in older individuals, I would straight away say that we probably require 2000 IU per day. Older meaning people over 50, those who are actually at risk for bone disease because of vitamin D deficiency. So we've told you that vitamin D is an important molecule. It is a vitamin, but actually it's more like a hormone. It is very important for our calcium metabolism. It's important to maintain our bones healthy. It's important for our muscular health. And we've also told you it might be important for a variety of other functions in the body, which includes, as I said, immunity, infections, metabolic disorders, diabetes, blood pressure, and even cancer. We've also told you that India is seriously vitamin D deficient. Regardless of the controversies about 20 nanogram or 30 nanogram being the optimum level of 25-hydroxy D in the blood, Indians fall way short of even 20. So we need strategies to combat vitamin D deficiency in India. What should we do as general public or as physicians? How should we deal with this? There are three ways to get vitamin D into the body. The first is sunlight. And it's obvious that Indians have so much sunlight, India has so much sun, there should be no problem. The other is supplementation, which means giving pills or other things, other vehicles that actually contain vitamin D, pills or sachets or powders or injections or whatever, to selected groups of people. And the third is fortification of food, which means adding vitamin D to milk or any other vehicle that would carry it. So when people are consuming that food, they get some amount of vitamin D through that. Three strategies. When we talk of sunlight, let's look at sunlight. I already mentioned briefly, we have type 5 skin. Type 5 skin is actually brown, pigmented, as you see in this slide. Classically Middle Easterners, Hispanics and some of us, which does not burn, it tans well, it is not sensitive to skin. And if you see the panel on the left, you will very clearly see that type 5 skin does not make vitamin D in a short duration of time as the white skin does, depigmented skin does. So you need greater length of exposure to sunlight with greater doses of sunlight, UV beta rays, to make adequate amounts of vitamin D. And that's how it is. So we need greater sunlight exposure to actually make enough vitamin D in our skin. And that, of course, is a challenge, because how would you do that? Supposing I say the best sunlight is between 11 and 3, which is correct. 11 a.m. and 3 p.m. So noon sunlight is the best. And we need, let's say, we don't know exact figures, but let's say we need 30 minutes of exposure. It means that we should leave our work and go and stand in the sun, take off our shirt and say, I'm not working now because I'm going to make some vitamin D in the sun. Is that practical? No. While we should encourage vitamin D exposure for our children and lots of other groups, it will be difficult for the average urban Indian to obtain adequate amount of vitamin D just through sunlight exposure unless they give up their jobs or do something else. Therefore, we have to think of supplementation as a strategy. When you use supplementation, we typically use in deficient people 60,000 units per week for 6 to 8 weeks. And what happens after that? It drops again, as a study from AIIMS showed that in a few months it drops again, and by 1 year it's back to baseline again. So you've given the correct dose, but you need to give a maintenance dose. And in our study, what we did, we gave 60,000 units per month to apparently healthy nurses who had really low levels at baseline. This is 60,000 per month. That study was 60,000 per week. And when you give 60,000 per month, you are able to maintain reasonable D levels, at least in summer. And in winter, you may be requiring little higher doses of vitamin D. So one sachet or one pill of 60,000 units per month will maintain D levels, reasonable D levels for the majority of Indian population. If you try to look at 500 units versus 1,000, many times we think that the calcium pill we are using contains enough vitamin D. So if you try to compare calcium pills with 500 versus 1,000 units, you actually find that even giving 1,000 units in postmenopausal women, in Indian postmenopausal women, in our study, although obviously it improved the D levels, did not achieve optimum D levels. And the mean D level became much better. There was wide variation. So even giving calcium pills that contain 1,000 units of D per day to postmenopausal Indian women was not sufficient to bring their D levels to optimum. And again, in this study where we compared a parenteral vitamin D of one shot of 3 lakh units, there's no such regimen that gives 6 shots of 6 lakh units. That is complete bunkum. We should not use that regimen. One shot, if we have to use 3 lakhs or maximum 6 lakhs, is equivalent to 5 or 6 doses of the 60,000 that we use, because remember, this shot is 6 lakhs or 3 lakhs units. So in this study, we compared 3 lakhs versus 5 doses of 60,000 and came out with comparable results. One shot. So do not fall for this trap of using astronomical doses of vitamin D of 6 lakh units per week for 6 weeks. That is dangerous. It produces toxicity. We have admitted lots of patients over the last few months with serious vitamin D toxicity because of overuse of vitamin D, overzealous use of vitamin D in wrong doses. These are the American guidelines for vitamin D recommended daily intake, published in June 2011, and I would just take you to what would be a good value for optimum D levels is above 1500 for Americans, so it will be about 2000 for us. Even if you don't believe that you require 30 nanograms, you still require at least 1000 units per day of vitamin D in Indians. So I would say, if someone to ask me how much vitamin D do Indians require, I would say between 1000 to 2000 per day, and I would say that those who are in the older age group actually require about 2000 or more per day to maintain reasonable levels of vitamin D for their bone and overall health. Is there an upper limit? The toxicity has not been seen by doses up to 10,000 units per day. 10,000. So there is a huge safety margin. But even then, if you start giving 600,000 or 6 lakhs per week, that is astronomical. So I'm re-emphasizing that 10,000 units per day means 60,000 per week, roughly. That's safe. You're going to go above that, there is no reason to go above that. That is sufficient. It will take some time, but your patient will recover well. So to conclude, overall requirements will be higher than generally appreciated or recommended. In India, typically, especially in older people, about 2000 or more per day may be required. And although outcome data is lacking in terms of its impact in India on fractures and other outcome variables, we still have enough data globally to say that certain vulnerable groups in India should be targeted for vitamin D supplementation. These should be older adults who are prone to osteoporosis. These should be pregnant women who should receive lower doses but still should receive vitamin D for their own health as well as the health of the newborn. And they should be growing children. You see, growing children is a particularly important group because it is during adolescence that they actually pick up all the calcium into their bones and build their bone bank. So it is from, let's say, during the growing years, let's say 10 to 18, that the maximum calcium goes into the bone. Now, in this period, if they are deficient in vitamin D, they will not build big bones. And rest of their life, they'll be struggling and they will get osteoporosis at an earlier age than the West. So we need to make sure that our kids are getting enough calcium and enough vitamin D. And the answer to that is drink your milk and play in the sun. That will give you calcium, that will give you protein, that will give you exercise, that will give you vitamin D. That's how we need to do it. So supplementation may be required for older adults, for pregnant women, and some children for sure. And the last strategy in this is fortification of food with vitamin D. And both vitamin D2 or D3 can be added to foods, and there is a dry stabilized form of vitamin D which contains an antioxidant, usually tocopherol, that preserves its activity even in the presence of minerals. So we could do many things with vitamin D. It could be added to milk, it could be added to yogurt, in Europe in margarine, and even orange juice, cereals, bread, mushrooms. However, remember that fortification alone as a strategy, while it will improve overall bone health, especially in a country like India, by itself may not be enough to reduce fracture rates because the amounts that go in necessarily through fortification are small. So it will be an add-on and it will help considerably our population which is still seriously or markedly deficient. But alone it may not be enough to reduce fracture rates, although only long-term data will tell us what happens in India with that. In this last part of my talk, we talk about fortification of milk as in a wonderful study done recently by Khadgawat and Marwaha, and which showed that actually when you add vitamin D to milk for school children, you actually achieve good vitamin D levels. You are able to achieve excellent levels. Look at this slide. A, B and C are the fortified groups. and you go from 11 to 22, 11 to 27, depending on the dose that you use, that's amazing. Showing the practical application of milk fortification given in schools with the midday meal, given this milk, and you find that there is significant increase in vitamin D levels. So just by adding vitamin D to milk. So that works. So in India, NIN and ICMR have suggested that there should be 4,400 IU per liter of edible oil. Another strategy now being practiced in certain states of India like Gujarat, and I'm told now MP and Rajasthan also, which are looking at adding vitamin D to edible oil. And we already talked about milk, and the recommended levels are given on the slide: 4,400 IU per liter of oil or 440 IU per liter of milk. To conclude this presentation, to combat the epidemic of vitamin D deficiency in India, we need awareness regarding sunlight exposure. We need supplementation for vulnerable groups, which I already emphasized, and we need fortification, an idea whose time has come. And we really should not be waiting for anything else. We have enough data to show Indians are D deficient, and we have some data to show that fortifying milk with vitamin D does work. So it's an idea whose time has come. We have been talking about this for a long time. India is vitamin D deficient, we need to do something. Knowing is not enough, we must apply. Willing is not enough, we must do. And I think that's the logic by which we should move forward. Thank you very much.